Hi, my name is Veronica Clark and I'm an adult speech and language therapist working with people with Parkinson's. People with Parkinson's may at some point develop a number of symptoms related to communication and swallowing. Everyone with Parkinson's is different, and some people may develop these symptoms earlier or later as the condition progresses, or not at all. But here are some things to look out for. You may notice that there's a change in the way your speech sounds. It may be less clear, or the volume of your voice may become lower. Your family may also comment on how they can't hear you as well as they did before, and this is known as dysarthria. If this is happening, try to think of speaking a little bit more loudly, or projecting your voice to someone at the other end of the room. This can help to improve the volume and the clarity of your speech. You may notice that there are changes in your ability to follow and participate in a conversation, or maybe you forget what you want to say, or you can't think of the right word to use. And this is referred to as a cognitive communication disorder. If this is happening, why not try to reduce distractions around you, like turning off the TV when having a conversation? And also be aware that multitasking can affect your concentration. So you may need to just pause what you're doing in order to focus on what you're saying. You may notice that you're having swallowing problems, perhaps coughing when eating or drinking, or food just not going down as smoothly as it did before, and this is known as dysphagia. Avoid eating the food you find most difficult until you've had a swallowing assessment by a speech therapist. You may also notice that you have excess saliva in your mouth and you might drool. This is known as sialorrhea. Try to increase the amount of times that you're swallowing every minute if this is something that you are experiencing. So make a conscious effort to swallow that saliva down so that it can't drip out of your mouth or down your throat. And these are all symptoms which a speech and language therapist can help you with. We can provide education and in most cases therapy to improve symptoms. It's important that you do this early so that we can help you to maintain the skills you have rather than regain them if they are lost. And why not keep a note or track of your symptoms in a journal, perhaps keeping details of what's happening, when they're happening, what helps and what doesn't. This information can be really useful during a speech and language assessment. If you notice any of these symptoms, then you should discuss them with your doctor or your Parkinson's nurse if you have one. Request a referral to a speech and language therapist, or just contact your local speech therapy department directly. A speech and language therapist would be happy to help you along your journey.